Do Abdul and Xenia have this particular link as well?
I think they do. I'm not sure if I think there was one of those who definitely couldn't make it today. I think that's what Tawanda said. I'm not sure.
The commissioner couldn't make it, yeah. The commissioner couldn't make it, but Abdul can, and then he would join, I think, with Xenia. But I'm WhatsApping Tawanda now.
Oh, great. Could you ask Tawanda to get their email address so that I can send them a special link? Please.
I have it. Shall I just send it to you?
Yeah, if that's okay. Yeah. Thank you.
Saves me.
Please assign us من قبل
So in a minute, I will start letting people join the webinar, if that's okay with everyone.
Yeah, please.
Thank you.
We have 3 minutes to 2. Good afternoon. My name is Joy Pumapi, the Executive Secretary of the African Leaders Malaria Alliance. A hearty welcome, Your Excellencies, members of the media, ladies and gentlemen, to the press conference of the Zero Malaria Starts With Me campaign. As you may recall, in 2018, the African Union and the RBM Partnership to End Malaria launched the Zero Malaria Starts With Me campaign. This campaign calls for all persons to take personal responsibility for ending malaria. While the COVID-19 pandemic has severely negatively impacted access to essential malaria services, governments, development partners, and communities have worked to ensure we remain on track to meet the bold and ambitious malaria targets that we set for ourselves in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. On the panel today, we have His Excellency, President Uhuru Kenyatta, the President of the Republic of Kenya and Chairperson of the African Leaders Malaria Alliance. We have Her Excellency, Mrs. Amira El Fadil, the Commissioner for Social Affairs at the African Union Commission. And we have with us Dr. Abdul Rahman Diallo, CEO, the RBM Partnership to End Malaria. Let me begin by welcoming Her Excellency, Mrs. Amira El Fadil, Commissioner for Social Affairs, African Union Commission, to give her opening remarks. Your Excellency.
Excellency President Uhuru Kenyatta, Excellency Abdurrahman Diallo, CEO of the RBM Partnership to End Malaria, Excellency and my sister Joy Family, ALMA Executive Secretary. Let me start, Excellencies, by giving my heartfelt condolences on the loss of our sister Joyce Kafanabo, the Senior Director at the ALMA head office in Dar es Salaam, Tanzania. We really felt sad losing our sister. May her soul rest in peace. Excellencies, ladies and gentlemen, and members of the press, let me take this opportunity to welcome you all to the press conference of the Zero Malaria Starts With Me campaign. This press conference is convened by His Excellency President Uhuru Kenyatta, the President of the Republic of Kenya, and the Chair of the Africa Leaders Malaria Alliance, known as ALMA. Excellency President Uhuru Kenyatta will provide key highlights on the Africa Malaria Progress Report and launch key initiatives to bolster action in the fight against malaria. These initiatives build on his 4 legacy agenda for ending malaria on the continent, the one we launched before in Nairobi, Kenya, and all the press were present in that launching. Dear participants, as you may recall, in 2018, the African Union and the RBM Partnership to End Malaria launched the Zero Malaria Starts With Me campaign. This campaign calls for all persons to take personal responsibility for ending malaria in Africa. And it calls for advocacy for controlling and eliminating malaria to remain high on the national, regional, continental, and global agenda. Engage and empower communities to act, and also to mobilize local resources and more additional resources, especially from the domestic private sector in Africa. Excellency, dear participants, I'm happy to let you know that 19 countries have already launched their campaigns, and we expect many more that they will launch their campaigns in this year, 2021. Now, more than ever, we need to keep malaria high on our agenda. Following the launch of the campaign in 2019, the Assembly of Heads of States and Government requested the chairperson of ALMA to report to the Assembly annually on progress in responding to malaria in Africa. While the targets in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030 are very bold and ambitious, I'm encouraged by the significant progress that is being made as highlighted in the African Union Malaria Progress Report, and I call upon all of you, please read the detailed report. All these achievements have been made while we are fighting head on the impact of the COVID-19 pandemic in Africa. Excellency, dear participant, we should continue the big push for new funding initiatives with a focus on domestic financing, such as End Malaria Funds and End Malaria Councils, increased roles for the private sector in Africa, invest in new innovations and tools, and above all, maintain the political commitment, shared responsibility, and global solidarity. Defeating malaria is a key element in building resilient health systems that are critical towards achieving the objectives of the Africa Health Strategy 2016-2030, and also for the implementation of our Agenda 2063 for the Africa we want. Excellency, thank you very much. I thank you as our champion for ending malaria in Africa. I thank Dr. Abdurrahman from RPM and my sister Joy, the Executive Secretary of ALMA. Thank you and shukran jazilan.
Thank you so much, Your Excellency, and we appreciate your condolences. May Joyce Kafanabo's soul rest in peace. Your Excellency, defeating malaria is a key element in building resilient health systems, so critical to achieving the objectives of the African Health Strategy and Agenda 2063, as you stated. To achieve the Africa we want. Indeed, we can only build resilient health systems if we ensure that we do not overstretch facilities by making sure that we timelessly tackle the biggest diseases on the continent, including AIDS, TB, and malaria, and also by eliminating neglected tropical diseases and providing quality, universal, reproductive, maternal, child, and adolescent health services. Even now, as we redefine the new COVID-19 normal. Please join me in welcoming His Excellency, President Uhuru Kenyatta of the Republic of Kenya, Chairperson of the African Leaders Malaria Alliance, to address you. Your Excellency, you have the floor.
Your Excellencies, members of the Fourth Estate, ladies and gentlemen, it is with great pleasure that I present to you the third annual Africa Malaria Progress Report that provides progress on how countries are implementing the flagship campaign of Zero Malaria Starts With Me. Ladies and gentlemen, the fight against malaria was in 2020 threatened by the coronavirus pandemic, especially here on the African continent. The pandemic disrupted our health systems, it slowed down economic activities, and increased vulnerability for large segments of our population. Indeed, at the onset of the COVID-19 pandemic, the World Health Organization had predicted a doubling of malaria deaths in the event of severe disruptions to the distribution of insecticide-treated nets and access to anti-malarial medicines. I am, however, delighted to say that the predicted doubling in malaria deaths was averted in our African countries. Malaria deaths have been contained through door-to-door distribution of 160 million insecticide-treated nets, indoor residual spraying, and through the administration of seasonal malaria chemoprevention for children. All of this has been done while strictly adhering to all COVID-19 protocols. But the fight, ladies and gentlemen, is yet to be won. Indeed, far from it. The World Health Organization, through their World Malaria Report 2020, states that Africa continues to bear more than 90% of the global malaria burden, and that progress in reducing malaria infections and deaths has been slowed, especially in high-burden countries. We, however, are still off track in achieving the ambitious targets that we set for ourselves in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. The COVID-19 pandemic has demonstrated the centrality of a robust healthcare system which provides universal access to all populations. Additionally, as African nations, our social economic recovery will also depend on our ability to innovate and generate solutions to issues such as malaria, issues which have for long bedeviled us. Africa must increase her capacity for local manufacturing of malaria commodities in a similar manner that we are now producing personal protective equipment for our own use. The spread and the development of the COVID-19 vaccine and the sharing of real-time data to inform decision-making provide instructive lessons for us in our efforts to eliminate malaria by 2030. I am confident that through working together, we can do it. And so I therefore urge my fellow leaders to champion the following actions in your respective nations. The first of these is to increase coordination and engagement on the elimination of malaria through regional economic communities. The second is to expand access to quality health care through national malaria scorecards to inform and to empower individuals and communities to take individual action. The third is to establish national end malaria councils and funds to convene senior leaders across all sectors to champion malaria and mobilize action, resources, and also to drive accountability. And fourthly, to recruit and mobilize a new generation of youth to combat malaria. I take this opportunity to congratulate the African Union member states for the demonstration of unwavering leadership towards the elimination of malaria by 2030, and in particular, the 19 countries that have launched and rolled out the Zero Malaria Starts With Me campaign, and I urge other countries that have not yet done so to launch the campaign as soon as possible. Let me also take this opportunity to thank the Global Fund for the financial support to the African Union member states, which enabled them to avert the predicted doubling of malaria cases on the African continent. Your Excellencies, members of the press, ladies and gentlemen, I now take this opportunity to launch the ALMA Scorecard Hub. This new platform will allow countries, as well as our development partners, to access information about scorecard management, tools for action, and accountability for malaria, reproductive, maternal, neonatal, child and adolescent health, and neglected tropical diseases. The scorecard is currently in use in over 40 countries and keeps track of progress of key health indicators to inform and empower health workers, local governments, and communities to act. Between 2012 and 2020, ALMA has supported over 80 national scorecards for malaria, neglected tropical diseases, reproductive, maternal, neonatal, child and adolescent health, nutrition, as well as several community scorecards. The use of the scorecard tool has had significant impact, with countries using real-time data to respond to outbreaks, shortages of staff or commodities, and improving quality of care. Scorecard tools have also facilitated increased financing and increased political engagement and accountability in matters health. The launch, therefore, of the ALMA Scorecard Hub is a key step in African countries' efforts to drive accountability, to achieve the bold targets set to eliminate malaria by 2030, and improve maternal and child health across our continent. I strongly encourage my fellow heads of state and government to publicly share their scorecards to their citizens through this hub. Your Excellencies, members of the Fourth Estate, ladies and gentlemen, the youth on the African continent constitutes more than 60% of our population and are a central asset to the social economic transformation that we desire for our continent. As such, increased participation and leadership by the youth is fundamental to the success of any program. In this regard, today, I am also pleased to launch the ALMA Youth Army Strategy, which shall provide a framework for engaging our youth across the African continent and develop a continental ALMA Youth Army for malaria elimination and contribute to the broader health and development agenda of our continent. The vision is to encourage our youth across Africa to advocate and drive action towards malaria elimination and the expansion of universal health coverage. The mission is to provide a platform to build a Pan-African movement of young people involved in the fight against malaria and other health priorities through advocacy, communication, and evidence-informed action. Let me conclude my statement by reiterating my own personal commitment to advance the malaria agenda in line with our continental commitments. Zero malaria starts with me, with you, and with all of us together. I thank you.
Thank you so much, Your Excellency, for your outstanding leadership. Your 4-point agenda will go a long way towards accelerating progress to eliminating malaria on the African continent. Let me take this opportunity, Your Excellency, to once again congratulate you on the launch of the ALMA Scorecard Hub and the ALMA Youth Army Strategy. At this stage, I would like to invite Dr. Abdulrahman Diallo, CEO of the RBM Partnership to End Malaria, to provide some remarks and launch the Draw the Line Against Malaria campaign. Dr. Diallo, you have the floor.
Your Excellencies, ladies and gentlemen, and members of the press, at last year's Summit of African Union Leaders, His Excellency President Kenyatta set out 4 priorities to end malaria in Africa by 2030. One of his key priorities is tapping into Africa's youth potential to drive a broader social movement in the fight against malaria. As part of this vision, the RBM Partnership to End Malaria, together with the African Union Commission and working closely with Malaria No More UK, the African Leaders Malaria Alliance and other partners, recognize the need to better engage young people to support the broader continental vision to eliminate malaria in Africa by 2030. Today, it is my privilege to formally announce an important new initiative to engage African youth in the fight against malaria, the Draw the Line Against Malaria campaign under the umbrella of the Zero Malaria Starts With Me movement, which is steadily growing across Africa. Zero Malaria Starts With Me, Draw the Line Against Malaria, will contribute greatly towards the implementation of His Excellency President Kenyatta's vision, the ALMA Youth Strategy, and will call on a new cadre of young advocates and champions to join the fight against malaria across the African continent. The campaign, which harnesses the best of Africa's creative talent, will create a unifying, groundbreaking, and inspiring global platform to capture youth and public imagination, rally communities and leaders behind the crucial fight to rid our continent of malaria. And it will pave the way towards this year's Kigali Summit on Malaria and NTDs to be held alongside the Commonwealth Heads of Government meeting. At the Kigali Summit, leaders will recommit to the vital efforts needed to end malaria, strengthened by the ever-growing corps of support delivered through this campaign. We've made great progress in the last 2 decades, yet there is much, much more for us to do. Malaria steals too many futures. It does too much to hold back the potential of our young people. To defeat malaria, we need to empower the next generation of young champions. There will be the generation that rids the world of this ancient and deadly disease and achieves a malaria-free future for all. Today, we must all draw the line against malaria and recommit to achieving zero malaria here in Africa and around the world. I thank you.
Thank you so much, Dr. Abdulrahman Diallo. Indeed, finding effective ways to better engage young people, including digitization, is critical to enabling our shared vision to eliminate malaria in Africa by 2030. Young people are armed with energy, innovation, and passion. Africa needs this driving force to ensure success in ending this terrible disease once and for all. I invite you all to watch 2 very short video clips that will provide more information on the Scorecard Hub and the Youth Army initiative that have just been launched by His Excellency President Uhuru Kenyatta.
The African Leaders Malaria Alliance, a coalition of all the African Union heads of state and government, is excited to launch the ALMA Scorecard Hub, an exciting new platform for countries and partners to access knowledge about scorecard management tools for action and accountability. Used in over 40 countries in Africa, the scorecard management tools track progress of key health indicators to inform and empower health workers, local governments, and communities to act. Between 2012 and 2020, ALMA has supported over 80 national scorecards for malaria, neglected tropical diseases, reproductive, maternal, newborn, child and adolescent health, nutrition, as well as community scorecards. The use of the scorecard tool has led to significant action and impact, with countries using real-time data to respond to outbreaks, shortages of staff or commodities, and improving quality of care. The ALMA Scorecard Hub platform provides an exciting opportunity for countries to publicly share both their scorecards and best practices on how they have used the tool to improve health outcomes. The ALMA Scorecard Hub also includes a wide range of materials for countries to learn about the scorecards and provides online courses for Ministry of Health staff.
The launch of the ALMA Scorecard Hub is a key step in African countries' efforts to drive accountability to achieve the bold targets set to achieve malaria elimination by 2030 and improve maternal, newborn, child, and adolescent health on the continent.
On assuming the chair of African Leaders Malaria Alliance, ALMA, His Excellency President Uhuru Kenyatta set out an ambitious legacy agenda. The agenda puts young people at the center of the fight against malaria on the continent. It is upon this premise that the African youth developed an ALMA Youth Strategy. This strategy will drive youth action across Africa towards malaria elimination and contribute towards universal health coverage.
We are the generation that will eliminate malaria in our lifetime through building a social movement that will engage with communities, government leaders, civil societies, and development partners on malaria and other health issues. We will advance the agenda towards malaria elimination, strengthen health systems, and achieve universal health coverage. Zero malaria starts with me.
As young people, we are ready to advocate for malaria elimination using digital technologies in order to strengthen the continental target of ending malaria by 2030. Zero malaria starts with me.
This youth strategy will mainstream malaria control and elimination efforts into existing youth structures. Moreover, young people will be granted access to the right advocacy tools, digital toolkits, and best practices in order to facilitate informed action against malaria.
Young people are demonstrating that they can do it. We are ready to form an army of youth advocates in Africa and in the diaspora so as to fight and defeat malaria.
Presently, the government of Kenya is pioneering the establishment of the first National Malaria Youth Army. This will serve as a benchmark to the rest of the African countries who equally plan to increase youth participation towards the achievement of the bold and ambitious targets set in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030.
There you have it. Young people are drawing the line using digital technology. Zero malaria starts with me and with you. Members of the media, please submit your questions via chat or raise your hand. We stand ready to respond to your questions. And thank you so much for attending. Okay, we are not seeing any questions either in the chat group or by raising of hands. I'll give you a few more minutes and then we'll close the press conference. It looks like it has been very effective. There's a question here. What are some of the ways that you think we could mitigate malaria by 2030? Would establishing a vaccine manufacturing plant in Kenya assist as a step in fighting malaria? Dr. Abdu, would you like to answer that?
Yes. Yes. Good morning, good afternoon, good evening, dear Sister Joy. Yes, with pleasure. What I would like to say is, if we look at what happened since year 2000, tremendous progress has been made in the fight against malaria. Because of the global community, global effort, all partners and countries coming together, we were able to save more than 7 million lives and prevent more than 1 billion new infections. So that progress has to be sustained. Unfortunately, it is stalling, but it has to be sustained. We all have this goal of eliminating malaria by 2030. We have now is time to really reignite, put an emphasis on our commitment, our engagement. We know that there are about 11 countries that still continue to carry the highest burden of malaria. So there is a strategy that is put in place to help those countries be on track. It is called high burden to high impact. And that strategy is articulated around 4 elements. And again, reinforcing, encouraging strong political engagement and leadership in the fight against malaria, the use of data to drive the fight against malaria, better guidance, better tools to come into the mix again, and obviously a coordinated action at the country level from all the partners involved. With that said, clearly there are certain priorities. We need to increase the funding to the fight against malaria. There is about roughly $3 billion deficit in the fight against malaria. The global community, including countries, have to come together to close that gap. We need to also insist on the use of better, decentralized, granular, stratified data to better guide our interventions in the countries. So we need to invest in innovation, because if we look at what happened up until now, malaria is as old as the humanity. But unfortunately, the parasite and its vector continue to outsmart us. So we need to continuously invest in innovation to stay ahead of the game. And we also have to invest in health systems. I mean, the answer is health systems. Malaria cannot be fight in isolation. So I liked what was said there about building, I heard, if I heard correctly, building a vaccine manufacturing plant somewhere. So I put that in the envelope of investing in innovations. We have to continuously work on having new tools, useful tools that can come into the mix. As we're speaking right now, there is a vaccine that is being piloted in Kenya, in Malawi, and in Ghana. And the idea is once that pilot is finished for WHO to make a policy recommendation on how to better use that vaccine and have it as an additional tool to the mix of those that we already have to fight malaria.
Thank you very much, Dr. Abdu. There is a question about how do you join the youth army? And we have a young person with us who can answer that question. So our youth focal point, can you answer the question, please?
Thank you, Ms. Joy. I hope you can hear me very well.
We can. Please go ahead. And introduce yourself before you speak.
Thank you so much, Ms. Joy. I hope you can hear me very well. So how do you actually join the ALMA Youth Army? In general, any young person is actually welcome to join the ALMA Youth Army through the National Malaria Control Programs, which we'll be working in close collaboration with the ALMA Secretariat. But however, it's up to you to look out on the opportunities within the ALMA website and social media handles when we're going to start the whole processes of actually operationalizing the ALMA Youth Army within the different countries within Africa.
Thank you so much, Petrita. Thank you very much. We have Naya Likunje. I apologize if I'm not pronouncing your name properly. You had your hand up. Okay, or should I just read your questions out because you are not responding? Your questions was, can we come up with some new method, like having some medicine that can be sprayed everywhere to kill mosquitoes? Your other comment was that in the 70s in Cameroon, nets were used to catch tsetse flies that were inflicting the population with sleeping sickness. Those nets caught all the tsetse flies and eliminated the disease. So why are they not having the same impact with mosquitoes? With regards to the first one about new technologies, Dr. Abdul Rahman Diallo and I are both members of the Medicines for Malaria Venture. It's a technology platform that invests in new technologies in the fight against malaria. And it is not the only technology platform. Earlier on, Dr. Diallo talked about vaccines that have been, the process of being developed. So new technologies are constantly being sought. And one of the advantages right now of engaging young people that we see is having young people, young scientists, more interested in this area, particularly on the African continent, so that they themselves can also engage in developing new technologies to fight this area. The question on nets, I would like to give to our senior technical advisor, Dr. Renshaw. Could you answer the question on nets, please? Why are they not killing mosquitoes like they kill tsetse flies?
Thank you, and thank you for the excellent question. It's long been a battle, malaria control, with as we throw something at the mosquitoes or the parasites, they evolve and become resistant to our weapons. So we have seen an increase of insecticide resistance across Africa in recent years to the insecticide on mosquito nets, which is a pyrethroid insecticide. So what we're doing now is rolling out nets with new insecticides and new mixes, which is going to make them, and actually does make them, significantly more effective, even against mosquitoes that have shown resistance. So in many countries across the continent this year, there will be millions of these new mosquito nets rolling out. And we believe that these will restore the nets to their full efficacy. We're already seeing in some countries from distributions last year that this was a great success. And we're not resting either. We're looking at future innovations, which include new types of insecticide that have never been used before. But moving forward, there's other mechanisms being tried, such as larval control from drones, and that's something Rwanda has been championing. And other examples include special baited traps to attract mosquitoes. So there's a whole host of new vector control methodologies that are being used and will be rolling out across the continent. Thank you.
Thank you, Dr. Renshaw. Dr. Abdul Rahman Diallo, there is a question here about how different is zero malaria, starts with me, from draw the line. This comes from Kofi in Ghana.
Yes, thank you, Sister Joy. A very good question. So the draw the line movement comes under the umbrella of the Zero Malaria Starts With Me campaign. So it's part of the Zero Malaria Start With Me campaign. I think what I would like to say here is the Draw the Line campaign is just to recognize the importance and role that the youth can play in reaching zero malaria, by 2030. The youth today can be the generation that can actually draw the line against malaria. So the movement is created to use the unifying power of art and entertainment to actually empower youth across the African continent and in fact beyond, to all get together and put their shoulders to the wheel in the fight against malaria, and specifically drive a number of points there, including political leadership and bringing them on board, advocacy, driving funding, driving innovation, actually using completely creative, fresh, new approaches to the fight against malaria to achieve what we would like to all see happen, which is the world free of malaria. And all that under the umbrella of Zero Malaria Starts With Me.
Thank you so much, Dr. Abdu. We have somebody who says that he cannot get through to us except through the chat. So if you can only ask through chat, please go ahead and we will answer. This is somebody called Moses. We will answer through the chat. There's a question from Charity Binka that there's a lot of emphasis now on digital campaigns. How will the messages reach the many Africans who are offline? And that's a very, very important question. How do the messages reach people who are offline? And I think this is an ideal question for the community scorecards approach. And it is something that you actually saw in the videos that we shared with you. But I would like one of our colleagues who actually works in this area to share this with you. Diego, can you please share with us the experience of community scorecards and how effective they are in engaging the community to participate?
Thank you very much, Joy. Good afternoon, everyone. This is Diego Duque. I'm a senior program officer with ALMA. We have a great example in Ethiopia and Ghana, where community members are actually being mobilized to become more active participants in health system strengthening. And they do this through something called the community scorecard, whereby community members actually meet every quarter and they are discussing indicators related to the quality of care that they're receiving. And so the emphasis is really for community members to have discussions about health systems gaps, and then seeing how they can best mobilize themselves to address some of the issues that they have identified. Excuse me. And importantly, what communities are doing is they're drawing action plans that address some of these systems gaps. And so through these community scorecards, which start off as a paper-based system, and communities are really able to systematically address some of these gaps. And so I think the community scorecards are actually a really good method of sort of getting to the people in the most rural areas that don't have access to internet or good connectivity. Over.
Sister Joy, with your permission, I would like to suggest also Xenia, who's on the line, to expand a little bit on the outdoor advertisement piece of the campaign besides the digital outreach.
Yeah, please. Thank you.
Thank you very much. Greetings, everybody. I hope you can hear me okay. Thank you very much for the question, Charity. Obviously, we do hope to engage everybody, whether or not they're online or offline, in the Draw the Line campaign. That having said, what we've seen is that obviously African youth is increasingly using digital platforms, social media, they access information in many, many different ways. So we would hope to have an integrated campaign presence across the countries on the African continent, and to make sure that we get to where the young people are and that we reach them through whichever means that we have, whether it's digital or out-of-door advertising. On a related note, you also, I believe, had a question regarding the role of media in the campaign. And here, of course, we absolutely welcome and encourage the engagement from our members of the press in the campaign beyond just simply covering what is happening. And as you obviously do it already in Ghana, there is a great potential in engaging journalists in coalitions in support of the Zero Malaria Starts With Me movement. So we absolutely applaud these efforts in Ghana, and we hope that other countries will also pick this up. Thank you.
Thank you very much. That is extremely useful. There's also a question, Dr. Diallo, which you might like to take about how do we involve public health officers in fighting malaria at community level. I think we have already talked about the use of the community scorecards, but what about the campaigns? How do public officers get engaged? Maybe you'd like to take that one.
Sorry, just a clarification. I didn't see the question. It's public health officers or just public officers in general?
It says public health officers. It's from Flora Shambi.
Yes. So I just would like to link this again to the Zero Malaria Starts With Me campaign. So just to clarify, the Zero Malaria Start With Me campaign is articulated around 3 points. One is, again, making sure that malaria remains very high on the political agenda of our leaders, and that we commit to the fight against malaria and mobilize the necessary resources to the fight against malaria. The second point being innovative a little bit about the funding of the fight against malaria, including bringing in the private sector and others. And the third point is where really it gets interesting, because this is where the community takes ownership of the fight against malaria. So recognizing that everyone has a role to play in the fight against malaria, from actively actually doing something, delivering an action, to holding the political leaders accountable to their commitments. And that's where I see really the general population, including public health officers, can be involved and can be engaged. I just would like to say that ever since the campaign was launched by African leaders in 2018, there are 19 countries that have successfully launched this campaign. And we've seen a great commitment, a great engagement to that effect, especially with the communities. There are some successes that are important to share there, and maybe that could be an inspiration to the person who asked that question. Since that campaign was launched, we've seen positive actions such as End Malaria Councils being launched in Zambia. And also we've seen a great involvement of the media. The Malaria Media Coalition in Sierra Leone is a great example. And then the parliamentarian coalitions in countries like Tanzania and Uganda, just to mention a few things. So it really created a platform and an opportunity for the general populations, and including public health officers, to be engaged. Not to mention that national malaria control programs sit within ministries of health that actually oversee and manage all health officers in the country.
Thank you so much, Dr. Diallo. You will have noticed, members of the media, that there is one of the founding members of the End Malaria Fund for Kenya, that is currently has just been appointed, Ronik Vera, and one of the things that we'll be doing on the Knowledge Hub is featuring sharing the experience of end malaria councils and end malaria funds from various countries so that they can learn from one another. And the ALMA Knowledge Hub is open to everybody. So you as members of the media, you will have a place where you'll have access to information. You will notice that when His Excellency President Kenyatta launched the Knowledge Hub, he said it is a way of getting the community involved and being able to engage with health care service providers and with each other on how they can contribute to the fight against malaria. So this is one of the ways that you can engage more effectively and more routinely than just waiting for a press conference such as this. We have a question from Babaka about the strategy of zero malaria. How can we make the link with fighting malaria and COVID-19 pandemic in the conflict context? He says his question is addressed to the whole panel. In the strategy of zero malaria, how the key actors can make a difference of community engagement in the COVID-19 pandemic. We have a lot of examples of that, but so that I don't speak on my own and Dr. Diallo doesn't speak on his own, I will ask Dr. Renshaw to just share with you a few examples from around the continent of where we were able to work in an integrated manner on malaria and COVID-19. Dr. Renshaw.
Thank you. There were a lot of examples in 2020 of sustaining essential malaria services whilst also ensuring the fight against COVID-19. And what was interesting is many of the so-called complex operating environment countries carried out their universal coverage mosquito net campaigns in 2020, and actually they adapted exceptionally well. It's possibly a reflection that they are used to being adaptable in their complex operating environments, but many of those countries were able to rapidly adapt the mosquito net campaign. So instead of having large numbers of people gathering together, the mosquito nets were distributed door to door whilst practicing safe social distancing. Countries in the Sahel carried out seasonal malaria chemoprevention, which is a treatment for children under 5, and more children than ever before, despite COVID, received these life-saving drugs in 2020. So it was really about countries flexibly adapting the existing guidance, and WHO and the RBM partnership provided support to adapting the existing guidance to how to carry out malaria control and prevention safely during the COVID-19 pandemic. And then zero malaria starts with me is central to everything, because zero malaria starts with me means everybody is involved in the fight against malaria, everybody takes ownership. And even during the difficult times of COVID-19, that we're all facing very difficult times, malaria still was maintained high on the political and health agenda, which meant that it was prioritized and that campaigns took place as planned, case management as much as possible took place as planned, indoor residual spraying and treatment for young children. So zero malaria starts with me is a fantastic opportunity because it keeps malaria high on the agenda. And then the RBM partnership, working with partners and under the very strong leadership of countries, managed to sustain the planned malaria interventions in 2020. And this is carrying on, of course, into 2021, because we are facing the second wave, especially in Africa.
Thank you so much, Dr. Renshaw. I don't know, Babaka, do you feel your question has been answered? And there's a word here that you used. I don't know whether you're talking about conflict as well, or did I read your question wrong? Are you able to talk, Babaka? Oh, he says he's fine with the response from Dr. Renshaw. People will forgive me if I've missed your question, but I don't see any other questions. And I don't see any hand that is raised. Am I wrong, or is that the case? If that is the case, then I invite all of you as members of the media, like I said before, to start visiting the Knowledge Hub, which we have just launched, and also to interact with us through the links that we have shared with you. Whether it is for the Draw the Line campaign or Zero Malaria Starts With Me campaign, or joining the Youth Army. And I just want to underscore here that when we talk about youth joining the Youth Army, we also mean members of the press. If there are young members of the press who want to become members of the Youth Army and engage in the fight, in ending the fight against malaria on the continent, you are very, very welcome. In fact, we welcome that approach of engaging young people where they already are, so that they can use the tools that they already have in order to enhance the fight against malaria and strengthen it. So having a media wing of the Youth Army would be absolutely wonderful, because it will enhance the engagement of young people and also enhance dissemination of messages and sharing with the community, and also accountability in the use of community scorecards. So please engage in this fight. The fight belongs to all of us, and Africa free of malaria will actually benefit not only in economic growth and development, but and health and well-being, but it will also benefit in leading globally on elimination of infectious diseases, because people tend to feel that Africa will always be the last to eliminate any infectious disease. And here's an opportunity for us to prove them wrong and to show that Africa can actually achieve a goal once it sets its mind to it. Thank you so much for participating in this press conference and this launch of the ALMA Knowledge Hub, of the youth strategy, and of Draw the Line for young people. We look forward to continuing to engage with you, and thank you so much for engaging in health, and please stay safe. COVID-19 is a challenge to all of us. Thank you.